recurrent urinary tract infections, as you mentioned, or recurrent bladder infections happening more than 2 times in a year, 2 times in 6 months, or 3 times in a year, so happening relatively frequently. If that happens, what is the recourse? Well, a very common thing that we do is put the patient on a suppressive antibiotic, and just a low dose of an antibiotic. How does it work? As you can see here, the bacteria, your body may allow these bacteria to hang around the opening of this urethra, which is fine, no damage done. But if they hang around in large concentration, just the act of wiping can push them into the bladder, and now that's bad news. Once they're in the bladder, they start multiplying and cause symptoms of a bladder infection, and then you have everything: urgency, frequency, and a full-blown UTI. So how can you prevent this? Well, a simple remedy is to give a low dose of an antibiotic that prevents this colonization of bacteria at the opening of the urethra. So if there's a low colony there, less bacteria will go into the bladder and less likelihood of getting bladder infections. So this is what a small dose on a nightly basis of an antibiotic does. I have several patients in my practice. Once we rule out any cause for these recurrent bladder infections, we put them on this low dose antibiotic for 3 to 6 months, and they do great. Now, typically, I don't like to continue beyond a certain time. So after about 3 months, I'm starting to drop it down and say I take it every other day, or we replace it with something which is non-antibiotic prevention.